Hi, my name is Ethan, and today we will talk about the subjects of drugs and everything related to it, such as the varieties, its consequences, or its utilities. I'm accompanied by specialist Jeremy and researchers Grace, Diego, and Fernando. Let's start. Well, I hope it's clear that drugs are bad if they are used in a non-medical way. Better breathe, follow, go ahead, and forget about the temptation. Don't ruin your life. I hope I've helped. See you the next time.
Hello everyone, my name is Dr. Jeremy Rivera and I will be explaining you everything you need to know about drugs and hallucinogens. Disclaimer: we do not recommend to use or experiment with any of these substances. If you want to try any of the legal drugs here mentioned, do it by yourself with good company in a safe and controlled space with responsibility. So, to begin with the legal drugs, we have the benzodiazepines, sedative, hypnotics, cannabis, tobacco, and alcohol. In this list, I will add the caffeine because it may seem harmless, but it has a lot of long term consequences. So, the illegal drugs we have in the illegal drugs we have cocaine, methamphetamine, amphetamine, hallucinogens such as DMT and LSD, and penicillin, opiates, inhalants, and ketamine. I will be explaining to you the physical effects of the consumption. In not too intense intoxications, the subject may be experience dry mouth, apathy, decreased muscle tone, incoordination, impaired consciousness in the form of drowsiness, and if the consumption progresses, these things, signs and effects will become more intense, leading to coma and respiratory depression. Many of the patients that are drug addicts may experience the psychological effects as well. So, in benzodiazepine intoxication, we have memory problems, decreased judgment, bad coordination, and speech troubles, among other cognitive and motor symptoms. So, you may seem that these people who is consuming any type of drug may be reacting like to the environment, but slowly. They will be dizzy, they will be goofy, even, you know. So at behavioral level, we can be associated these symptoms of behavioral disinhibition, which in some people can lead to hostile or aggressive behavior. This effect is perhaps more frequent when these drugs are ingested mixed with alcohol. So we have another bad side in the use of drugs, that is not only the consumption problems but the abstinence problems. As you may know, when you stop eating or consuming or having any substance in your body, it may cause a lot of troubles, such as intolerance to bright light and loud noises, sweating, nausea, vomiting, and decreased appetite, muscle contractures, tremors that can lead to seizures. In relation to the emotional consequences, we have affective discomfort, dysphoria, and anxiety may be appear. The majority of the drug addicts tend to develop a lot of psychical trauma called PSTD, and also they tend to uh, be depressed and have anxiety crisis. So these are the bad and the best reasons. So why do you don't need to consume any of these substances? I hope you have understand my info, and I will recommend you to stay away from these substances. Chill, my friend. Goodbye.